Hello, I'm Dr. Hornbrook, and welcome to another episode from View from the Other Side of the Bench. As many of you know, I have two really positions in my life, and one is I'm the Clinical Director of Education and Technology at Utah Valley Dental Arts in Provo, Utah. And the second is I have a clinical practice in San Diego. So we created these series so that we can think like a ceramist on the side of the bench, and we can also think like a clinician and understand how to communicate better and maybe some of the problems that both sides are facing. Today we're going to talk about the FCZ crown, or the full contour zirconium, or it could be lithium disilicate, EMAX, on a titanium base. And this is monolithic zirconia. Again, this could be EMAX or lithium disilicate. Some of the doctors like to use that versus zirconia. This is designed and milled here at Utah Valley. And then it's cemented to a titanium base. This is going to be a screw-retained implant crown. So let's go through the technique. The first thing we need to do is prepare our zirconium or our lithium disilicate for optimized bonding. Now this has milling debris, or it may have moisture, it may have some oils from the milling process. So the first thing I like to do is just take some denatured alcohol. You could use isopropyl if you wanted to, denatured alcohol, and I will just clean the inside of this full contour crown. Again, whether this be zirconia or whether it be lithium disilicate, I'm going to do the same thing. Then we're just going to air dry that. So our crown, our ceramic is clean, and now we're going to do the same thing for our titanium base. This is gold anodized, but we're just going to clean up because it has oil from my grubby little fingers. We're just going to clean it real good, and then we're going to air dry this. Okay. Now we can get a chemical bond to the zirconium as well as the titanium base. We certainly can get a chemical bond to our lithium disilicate. We have a couple options here. You can either buy a separate zirconia primer like Z Prime Plus and a separate silane coupling agent, or Ivoclar has a very unique product called Monobond Plus. And Monobond Plus is unique in that it has an MDP monomer, so it will bond to metal being the titanium or the zirconia, and it also has silane, so it'll bond to our ceramics like EMAX. So we're going to go ahead and dispense a little bit of this. We're going to get a new brush. We're going to paint the inside with the Monobond Plus. Set that aside, and then we're going to paint the titanium abutment with the Monobond Plus as well. And then we're going to let that sit for 60 seconds. Let's assume it was 60 seconds. We're going to dry this off. Dry off the inside of the crown. Now ahead of time I obviously tried that and make sure it fit. Sometimes these abutments are cylindrical and margins may be circumferentially in the same location. So I just like to take a Sharpie felt pen. I will mark below the margin, and I'm going to pick the buccal side here because I know where the buccal crown is, so I can go ahead and just do that. Okay. Now we're going to go ahead and cement it. And you could use a dual cure resin cement, or you can use a cement that's designed with this specifically in mind. Ivoclar has a cement called the Multi-Link Hybrid Abutment. It's a self-cure, has an MDP monomer, so it'll chemically bond to the metal or the zirconia, and it is self-cure. Because this crown is so thick, we may not be able to light cure through this. So we're going to go ahead and dispense a little bit on a well. Again, it's bright white opaque to neutralize that gold or that metal. I like to paint a little bit on the inside of the crown. Paint a little bit on the abutment. And these fit so well, we don't need a lot of cement. You have about a minute working time. It goes to a gel state at 2 minutes. We're going to look for our buccal orientation. We're going to put that to place and hold it down completely. Now, it needs to be held down tight for 2 minutes. Some clinicians like to take a micro brush, clean up the excess. I prefer not to do that. At the laboratory here, we don't really like to do that because sometimes, and I've seen it not certainly at this lab, but in other scenarios, where the crown doesn't fit the base quite as well as we would like. It's not a big problem because it's going to be filled with cement. But what I don't want to do at this point is take a brush and pull that cement out of that margin. So we're actually going to time it for 2 minutes. After the 2 minutes, let's assume it's 2 minutes, I just like to take a barred Parker blade, and we're just going at the gel stage. It just cleans up really, really nicely. We're going to take another micro brush. We're going to make sure that there's no cement down in the screw hole. These micro brushes, you can go all the way through the end. Oops. Let's put that back in. Where's our orientation? There it is. And then we're done. Now, as far as bond strengths, Ivoclar in their dental laboratory have actually found that at 15 minutes, and that's your set time with us, at 15 minutes you get about 35 to 40 megapascals. So we do get a bond. At 24 hours, they got over 45 megapascals. So the laboratory, obviously, this is going to sit for at least 24 hours before we send it to you. If you're going to do it clinically in your office, and let's run through that scenario. Obviously, this is something the laboratory is going to do for you, or if you're a CEREC doc or a plan scan doc, you may be milling these chairside, and now you have to cement it. So we're going to use the exact same protocol. For the CEREC and the plan scan docs, again, try to do it ahead of time so it's at least 15 minutes. And another scenario that we haven't really talked about, and that's if the patient had one of these crowns previously placed, whether it's by you or another dentist, and they give you a call and say, hey doc, my crown fell out, and you come into the operatory and you see that, yeah, they have the monolithic zirconia or Emax crown in place, and the titanium abutment is still screwed into place. For some reason, it doesn't happen very often, that bond between the ceramic material and the titanium failed. So in those scenarios, we need to employ these same materials. So we would go ahead and unscrew the abutment. We would then prepare the abutment just like we did here. Alcohol, zirconia primer. We would go ahead and find out, and usually you can tell just by the way it's milled, the milling marks, and the appearance of the inside, is this lithium disilicate Emax or is it zirconia? It's zirconia. We're going to clean with alcohol and a placed Mono-On Plus or a zirconia primer. If it's lithium disilicate, we're actually going to use hydrofluoric acid etch. That's what we're going to do in the laboratory with these materials. Hydrofluoric acid etch, put on the internal, let it sit for at least 20 seconds, rinse, air dry thoroughly, place a silane coupling agent on the titanium. Again, you're going to take it, it's going to be outside the mouth. You're going to go ahead and clean it with denatured alcohol. You're going to go ahead and use the zirconia primer or the Monobond Plus. And then we're going to cement it to place. If you don't have this multi-link hybrid, you can use any dual cure resin cement. Don't use a light cure, but you can use a dual cure resin cement. I hope that helps. It's a very common question in my lectures where dentists either propose it, like, how does the laboratory do that exactly? There you got it. Or dentists that say, hey, I want to do this chair side. How should I prepare those two surfaces? I hope that helps and you have a wonderful day.